Right. So today we're going to jump into a topic that can be kind of scary for some folks, but it's really important. And that is labor and birth complications.
Mm,
And we are looking at a nursing textbook chapter here, which I think is really cool because it gives you that perspective, not necessarily of the patient, but of the professionals who are actually in the room. And what are they looking at? What are they thinking about? How do they handle it when things go wrong?
absolutely. And I think that perspective is really helpful because, like you said, it's something that can be a little bit frightening. But when you
Yeah.
start to understand like the clinical perspective, it kind of takes the edge off a little bit, and you feel a little bit more empowered.
Yeah. It's like knowledge is power, right?
Right, exactly.
Okay. So let's dive right in. The first topic that this chapter really tackles is preterm labor and birth, which it feels like, anecdotally you hear about all the time, people who had their babies early
Yes.
and whatnot.
It's a very common complication. And the chapter really emphasizes the difference between preterm birth and then just having a low birth weight baby, and making that distinction because those are two different things. So preterm labor is the contractions, cervical changes, all of that happening too early. So anywhere from 20 to 37 weeks of pregnancy.
Yep.
And then preterm birth is defined as any birth before 37 weeks gestation, regardless of how much the baby weighs.
Okay. So you could have a baby born like at 36 weeks
Yes.
who weighs a totally normal amount, or you could have a baby born at 40 weeks who's tiny.
Exactly, exactly. So we often use those terms interchangeably, but it's important to know those are distinct things. And just because the baby is small doesn't mean it was born early. And just because it was born early doesn't mean that it's automatically going to be small. But one of the interesting things that the chapter highlights is that being born preterm is actually a greater risk than just being born with a low birth weight. So low birth weight is a baby under 2,500 grams. So being born preterm has a lot of, potential complications because those organs haven't fully matured and developed.
So it's not just about size, it's about their actual like biological development.
Exactly. It's about the gestational age and the development of those organs.
Okay, so what are some of the like risk factors, like the red flags that someone might go into preterm labor? I think a lot of people, the obvious ones, like if you've had a preterm baby before, if you're having multiples,
Yeah.
things like that.
Right, right. So some of the factors you'd probably expect, history of preterm birth is definitely one of those if you're pregnant with multiples. Infection is actually a very common cause of preterm labor. Even things like, unfortunately, African American women have a higher incidence of preterm labor.
And is it known why?
There's not I don't think they've determined a specific cause for that,
Yeah.
but that is a risk factor. And then some of the other things, kind of surprising, maybe you wouldn't expect, is things like bleeding in your second trimester of pregnancy can increase your risk for preterm labor.
Yeah, that's not something you would think
I
about.
do. Yeah.
Or even going into pregnancy underweight can increase your risk.
Oh, wow. Interesting. Okay, so are there like any kind of tests or anything that they can do to try and predict if someone's like likely to go into preterm labor? There are, yeah. They have, doctors have a couple of tools in their toolbox. So they can test for something called fetal fibronectin, and that's just a protein that's found in vaginal secretions. And if it's present too early in the pregnancy, that can be an indicator of preterm labor. And then also measuring the cervical length. So a shorter cervix, earlier in the pregnancy can also be an indicator that there could be some preterm labor on the horizon. But a lot of the root causes of preterm labor actually have to do with infection or bleeding around the placenta, which can be, kind of difficult to predict.
Right. So it's not always something you can see coming a mile away,
Right.
but there are some tools
Yeah.
that they can use. Okay, so what about, like, what can you actually DO to prevent it?
Yeah. A lot of it is kind of common sense, but it's important to reinforce, overall good health before you even get pregnant is a huge factor in preventing preterm labor. And then, of course, during pregnancy, avoiding those risk factors we talked about. So making sure you get good prenatal care. Um, and there are even interventions specifically aimed at preventing spontaneous preterm birth that they can do.
Yeah. And so then what if you DO start going into preterm labor? What happens? What are they looking for?
So they're going to be watching for those signs that the cervix is changing too quickly. So if you're 80% effaced or 2 centimeters dilated before 37 weeks, that's a big red flag. They're going to be watching for that.
And then once it's confirmed, like, what can they DO?
So kind of a multi-pronged approach. First of all, they're going to try to decrease the stress on your body. So that might be, bed rest, limiting work, things like that. Not always fun,
Remember.
but it can help slow things down.
Yeah.
And then they might use medications called tulcolytics. And these are medications that help to suppress uterine activity.
So it's basically telling your body to chill out for a minute.
Yeah, basically saying, pump the brakes, uterus, calm down.
Yeah.
And the goal here is really to buy some time.
Okay.
So while you're chilling out and limiting the stress on your body, they might give you a course of steroids to help the baby's lungs mature faster, just in case.
Okay. So are they actually trying to stop the birth or?
Yeah, it's not about stopping it. It's just about slowing things down so that they can give the baby the best possible chance.
Yeah. Okay. And what about, like, how often do they use the steroids for the baby's lungs?
Well, the NIH actually recommends them for all women who are at risk of preterm birth between 24 and 34 weeks.
Oh, wow. Okay. So that's not just like a last-ditch effort. That's pretty common.
Yeah, it can be pretty standard if you're at risk.
And you said it can make a big difference.
Yeah, it can. It really helps, especially in those first 24 hours after they're given.
Wow. Okay. So then, like, worst case scenario, what if, like, despite all of that, the baby just decides it's coming out early anyway? What happens?
Well, then it's all hands on deck. They might give you magnesium sulfate again, but this time it's actually to help protect the baby's brain.
Okay.
And then, they've got to be prepared for anything at that point. The baby might be breech, they might have breathing problems, they might need to be resuscitated, so there's a whole neonatal resuscitation team standing by just in case. And even then, sometimes tragically, those babies just aren't ready yet, and they don't make it. But, luckily with all these advancements that we've made, more and more preterm babies are surviving and thriving.
Yeah, which is amazing. Shows how important it is to take it seriously.
Yeah.
Okay, so moving on, the next kind of hurdle that this chapter talks about is PROM, premature rupture of membranes.
Yes.
Which, I mean, most people, I think, probably just know that as like your water breaking early, but is there more to it than that?
There's a little more nuance to it. So we have to differentiate between just regular PROM and then PPROM, which is premature rupture of membranes.
Okay.
So PROM is just when your water breaks before labor begins, so that could be at any point. But then with PPROM, that specifically happens before 37 weeks.
Okay. So the preterm is about how far along you are.
Exactly, yes.
Not just the actual
Not just the water breaking itself.
water breaking. Yeah.
Yes. And with both PROM and PPROM, the greatest risk is infection. Because that amniotic sac, it's meant to be this nice, sterile, protected environment for the baby. And once it ruptures, the clock is ticking at that point. So if you're full term and your water breaks, they'll often go ahead and induce labor to just get things moving. But if it's preterm, then it's often more of a waiting game, and they usually want to hospitalize you just to, keep a close eye on things, make sure there's no infection developing.
Right. Makes sense. You don't want to rush it if you don't have to. And speaking of infection, that leads us to the next thing. Chorioamnionitis.
Yes.
I'll be honest, that sounds
That's a mouthful.
scary.
Yes, it is. But basically, it's a bacterial infection that occurs inside the amniotic sac.
Okay.
And so, obviously, that can cause a lot of, a cascade of problems. And it's present, in 1-5% of full-term births, which is, already not great.
Yeah.
But with preterm births, that number jumps to 25%.
Oh, wow. That's a huge difference.
Huge difference, yeah.
Okay, so how do they know if someone has chorioamnionitis? What are they looking for?
So some of the clinical findings would be a maternal fever, the baby's heart rate might be elevated, and sometimes there's even a foul odor to the amniotic fluid.
Oh, yikes. So much for that, like, peaceful, water birth vibe.
Exactly.
Okay, so now we're going to shift gears a little bit and talk about kind of the opposite end of the spectrum, the post-term pregnancy. And, I think a lot of people, when they hear post-term, they just think, oh, you're overdue. It's kind of annoying, but not necessarily dangerous.
It can be annoying, yeah.
But
But unfortunately, going past 42 weeks does bring along some risks for both the mother and the baby.
so what kind of risks are we talking about here, besides just like wanting the baby OUT?
Yeah, so for the mother, there's a higher risk of labor not progressing normally, increased risk of tearing during delivery because the baby might be larger, and even some bleeding and infections afterward. They're also more likely to need interventions like an induction or a C-section, which of course come with their own risk. And let's not forget the psychological impact. Being pregnant for weeks longer than you expected can be emotionally and physically draining.
Yeah. Okay. And what about for the baby? Like if they're already full term, would they just kind of be, I don't know, like extra cooked?
Extra cooked. Yeah, that's a good way to put it. It's not quite that simple, unfortunately. Sometimes they do get too big, which can actually make delivery harder, and there's a higher risk of injury. Plus, the placenta starts to age, so it doesn't work as well, which can affect how much nourishment and oxygen the baby's getting. And then there's this condition called oligohydramnios, which is just a fancy word for a decreased amount of amniotic fluid, which can also be dangerous for the baby.
Okay. So post term is actually something to be taken pretty seriously.
Right.
How do doctors manage that then?
Yeah, so you would think there would be a straightforward answer, but even this is debated. Most doctors will go ahead and induce labor around 41 weeks just to avoid those risks that we talked about. But others like to take more of a wait and see approach. So they might monitor the baby closely with special tests just to make sure everything is okay. But, unfortunately, there's not a one size fits all answer, which I guess, applies to so much of pregnancy and birth.
Yeah, it's not
So it's like, I'm
Yeah, exactly. It's finding out what's right for each individual person.
yeah.
Okay, so then we get to the next complication, which I think kind of speaks for itself. Dysfunctional labor, otherwise known as dystocia, which is basically just like when labor is long or difficult or just abnormal in some way.
Yes, basically.
No kidding.
Yeah.
What causes that to happen? Is it just bad luck?
Not necessarily. The chapter kind of breaks it down into a few different categories. So it could be
Mhm.
the power, meaning the uterine contractions just aren't strong enough or effective enough to get the job done. Or it could be the passage, so that has to do with the mother's pelvis or the soft tissues and any kind of abnormalities there that might make it hard for the baby to pass through.
Okay, so it's like those two things kind of have to work together perfectly,
They do.
or else things get messy. Is there anything else?
Yeah, and then there's the passenger, meaning the baby. So if the baby is in a weird position or it's too large for the pelvis, which is called cephalopelvic disproportion or CPD for short, that can cause problems as well.
Yeah, that makes sense. And you mentioned something about the mother's position, like her physical position and her psychological state playing a role too.
Yes, absolutely. This is where it gets really interesting, I think, because the mother's mental state is so important during labor. If you're exhausted, if you're dehydrated, if you're scared out of your mind, your body tenses up.
Right.
That happens to all of us. Well, same thing happens in labor. So, it's not just a matter of like toughening up or using willpower. Like your mental state actually affects how your body labors.
That's crazy.
It is. It's really fascinating.
Okay, so all of that is just kind of the tip of the iceberg when it comes to dystocia.
Yeah.
And it's crazy how many things can go wrong. Speaking of things going wrong and then having to fix them, this next section of the chapter talks about all the different procedures that they use.
Yes. Lots of interventions.
So many procedures to, try to like, I don't know, help things along, I guess.
Yeah.
So like some of them I think are pretty common, like versions where they're trying to turn the baby from like a breech or sideways position
Mm-hmm.
to be head down.
Yeah.
And I know sometimes they do that like externally just by pushing on your belly,
Right.
but sometimes they have to go in, which is much more invasive.
Yes. So they can do an external version, just kind of, manipulating the belly, but then sometimes they have to do an internal version, which is, a bit more invasive.
Yeah, you can imagine. Okay, and then there's induction, which I feel like is just becoming like more and more common these days.
It is. It is becoming more common. And there are guidelines for when it's appropriate. So doctors use what's called a Bishop score, and that's basically just a scoring system to see how ready your cervix is for labor. So
Yeah.
the higher the Bishop score, the more favorable your cervix, the better chance you have of having a successful vaginal delivery.
Oh, so it's not just like picking a day and be like, let's go.
Right, right. They really do try to let things happen naturally as much as possible.
Yeah. Okay, and then what about, there's all these cervical ripening methods that I've heard about. What are those?
Yeah, so those are kind of like the pregame show before induction.
Okay.
So if your cervix isn't quite ready, they can use different methods to try to soften and thin it out to make it more likely to dilate. So, there's chemical options like prostaglandins, mechanical ones like, a balloon catheter, and even some alternative approaches like acupuncture or evening primrose oil, lots of different options.
Interesting. So it just depends on your situation and kind of your preferences, I guess.
Yeah, and what your doctor thinks is most appropriate for your specific situation.
Okay, and then what about amniotomy? Isn't it just a fancy word for like breaking your water?
Yes, that's exactly what it is. And it's often used, in conjunction with induction or if they just need to speed up labor for whatever reason.
Okay, yeah. And then the chapter talks a lot about the use of oxytocin, which the hormone our bodies produce naturally.
Right.
But they also have a synthetic version, which is,
Yeah. So it's both. We make it naturally and we can also give it synthetically.
right. And they use that like to either start labor or to like strengthen the contractions if they're too weak.
Exactly. So induction or augmentation.
Right. But the chapter also kind of flags it as like a high alert medication, which sounds kind of scary.
It can be. Yeah. It's definitely powerful stuff, so it has to be used carefully. Because, if it's not managed properly, there are some serious risks like the placenta detaching from the uterine wall, uterine rupture, even the baby not getting enough oxygen.
Yeah, that's intense. So it's not a decision they take lightly, I'm assuming.
Absolutely not. They're going to weigh the benefits and the risks very carefully.
Right. And I'm guessing they're like monitoring you really close
Extremely closely, yes.
if they're using it. Okay. And then kind of on that same note, what about like the forceps and vacuum deliveries?
Yeah, so those are what we call instrumental deliveries, and they're used when we need to give a little bit of extra help to get the baby out vaginally. So forceps are these smooth, curved instruments, and they fit around the baby's head to help guide it out. And then vacuum extraction uses like a little cup that attaches to the baby's head with suction, and that helps to, pull the baby out.
I'm assuming those are used pretty sparingly.
Yes, they're not used all the time. So it might be because, the pushing stage is taking too long. Maybe the baby is showing signs of distress, even if the baby is breech. It's all about getting that baby out safely when a vaginal delivery is still possible.
Gotcha. Okay. And then the big one, cesarean birth. Seems like everyone these days knows somebody who's had a C-section.
Right.
So why would someone actually need a C-section? Is it always like an emergency situation?
No, not always. Sometimes it's planned in advance. So that might be because, the baby's breech and can't be turned. Maybe the mother has a health condition that would make vaginal delivery risky.
Okay.
But other times it's a decision that's made during labor. So maybe the baby's in distress or labor's not progressing or there's a problem with the placenta.
Yeah. And I know there are those elective C-sections where it's like the mom's choice to have a C-section.
Right. Yeah. But usually, that's a decision that's made after a lot of discussion with their provider,
Right.
Weighing the pros and cons.
Yeah. And I guess the chapter, it includes a safety alert about C-sections. Like, even though they're common, it's still a major surgery.
It is. It is
Yeah.
major surgery. And,
Yeah.
after the surgery, moms can be drowsy from the anesthesia, and they could potentially fall asleep while holding the baby. So nurses and family members need to be extra vigilant and make sure mom is well supported and she's not, nodding off with the baby unsupervised.
Yeah, that makes sense. You don't want to take any chances
Exactly.
when you have a newborn.
Mm.
Okay, so last but not least, the chapter wraps up talking about VBAC and TOL, which sound a little like alphabet soup to me.
Yeah, they do, but they're actually pretty straightforward.
Okay.
So VBAC stands for vaginal birth after cesarean, and TOL stands for trial of labor. And these are both options for women who have had a C-section before but want to try for a vaginal birth.
So VBAC is like actually attempting the vaginal birth.
Right. It's the vaginal birth after you've had a cesarean.
Right.
And then the TOL is more like, it's like a test run.
Okay.
So they monitor you closely during labor to see how things are progressing. And if it looks like a vaginal delivery is possible and it's safe, then great, you get your VBAC. But if at any point there are signs of trouble, then they can quickly switch to a C-section. So it gives women a chance to experience vaginal birth, but with a safety net.
Yeah, that makes sense. Okay, so we've covered a lot of ground here, from preterm labor all the way to different delivery methods.
Yeah.
It really highlights just how many things can go wrong
Yeah, lots of things.
during labor and delivery. And I mean, it really makes you appreciate the expertise and the quick thinking that these nurses and doctors have to have.
They have to be on their toes. But, it's not just about reacting in the moment, right? Like a lot of what we talked about comes down to prevention. So that's why prenatal care is so important. It's about identifying those potential risks early on and trying to minimize them as much as possible. Like, I always think of it like a good defense in a football game. You're trying to prevent those touchdowns before they even happen.
Love that analogy.
Yeah.
Okay, well, stay tuned because in the next part, we're going to talk about like what all of this actually means for you, the listener,
Yes,
and how you can use this knowledge to have a safer and more informed birthing experience.
absolutely. So we're going to kind of shift gears a little bit and take everything we've learned and talk about how it applies to you.
Awesome. So stick around.
Yes, don't go away.
Going through that whole list of potential complications really makes you appreciate those, like nurses and doctors who are on the front lines.
Yeah.
They got to be ready for anything.
They do. They really do. It's like, it's not just about delivering babies. It's about knowing what to do when things go wrong.
Right, exactly.
And a lot of what we talked about, it really comes back to prevention, which is why that prenatal care is so important. It's like
Mhm.
you're trying to head off those problems before they even start.
Yeah, yeah, totally.
Yeah.
And one thing that really struck me reading this chapter was how much they emphasize like the mental and emotional side of labor.
Oh, absolutely.
We always hear about the physical challenges, but it's like your mindset really plays a role too, huh?
It's huge GE.
Yeah.
Fear, anxiety, exhaustion, all of those things can actually affect how your labor progresses.
Seriously.
Yeah, think about it. When you're stressed out, your body's pumping out all that adrenaline and cortisol,
Right.
and those hormones can actually interfere with the release of oxytocin.
Wait, so oxytocin, isn't that the hormone that helps with like contractions?
It is. It's often called the love hormone,
Oh, wow.
but it also plays a key role in labor. So basically, being stressed out can actually slow down your labor.
So it's not just like, mind over matter. There's a real physiological.
There's a real connection there.
Wow, that's fascinating.
It is. It makes you realize how important, a calm and supportive birth environment is.
Right. It's not just some like fluffy feel-good thing.
Exactly. Having a doula or a partner or a family member there to support you
Hmm.
can make a world of difference.
Yeah. Yeah. It's like having your own personal cheerleader.
Exactly.
It makes me wonder if there's been like research on different birth settings, like if women who labor at home or in birthing centers have fewer complications.
That's a great question. There has been some research on that. And it's complex, but some studies suggest that low-risk women who give birth in a more home-like setting with like continuous midwife support might have lower rates of interventions.
Huh. Interesting. So maybe there is something to that, like feeling empowered and in control.
Feeling safe and comfortable.
Yeah, that helps things flow more smoothly.
Potentially. It's definitely an area for more research.
Yeah, for sure. And it kind of brings up this whole idea of informed consent and shared decision making, which I feel like we hear a lot about these days.
Oh, yeah. It's a hot topic for sure.
But what does that actually look like in the context of like childbirth?
So basically, it means that why you get to be an active participant in your care,
Okay.
not just a passive recipient. You have the right to understand, like, what are the risks and benefits of different interventions? What are the different options? And to make choices that align with your values and preferences. It's a collaboration between you and your healthcare providers.
I mean, that sounds great, but I imagine it's a lot harder to do in practice when you're like in the middle of labor and decisions have to be made quickly.
Oh, for sure. It's not always easy. That's why, prenatal education is so important. Talking to your provider beforehand, coming up with a birth plan, thinking about those different scenarios that might arise.
Yeah.
That can really help you feel more prepared and empowered to make those decisions, even when things are intense.
Yeah. Yeah. That makes sense. It sounds like finding a healthcare provider you trust and can really communicate with is like essential.
Oh, absolutely. Childbirth is such a vulnerable experience. You need to feel confident that your care team is listening to you, respecting your wishes.
Absolutely. Okay, shifting gears a bit, another thing that like really jumped out at me from this chapter was the sheer number of like procedures that are described.
Yeah, there are a lot.
It's amazing how much medical technology has advanced, but it also makes you wonder like when are all these interventions really necessary and when are they maybe being overused?
That is the million-dollar question, and honestly, it's a debate within the medical community all the time.
Really?
Oh, yeah.
Hmm.
Technology has given us some incredible tools, but it's always about finding that balance,
Right.
weighing the benefits against the risks. It's like you don't want to use a sledgehammer when a regular hammer will do.
I like that. So it's about using the right tool for the right job. We
Exactly.
were talking about oxytocin earlier.
Yeah.
It's a powerful tool, but it also has potential downsides.
Definitely.
So that's where that informed consent comes in again, right?
Big time. You need to understand the risks and benefits so you can make an informed choice. And don't be afraid to ask questions.
Yeah, absolutely. It's your body, your baby. You have the right to know what's going on.
Exactly. You're not just blindly following orders.
Right. And speaking of like things to be aware of, the chapter also talks about um, off-label use of medications.
Oh, yeah.
Can you explain what that means for those of us who like don't speak doctor?
Sure. So basically, off-label just means using a drug for something other than what the FDA, the Food and Drug Administration,
Yeah.
specifically approved it for.
Okay.
So it might be approved for one condition, but then doctors realize, hey, this seems to be helpful for this other thing too.
Interesting. So is that like a bad thing? Is that dangerous?
It's not inherently bad. I mean, it happens all the time in medicine,
Okay.
and sometimes it really is beneficial. But obviously, when you're talking about pregnancy,
Right.
you have to be extra cautious.
Yeah. Because now you're not just talking about the mom's health.
Exactly. Now you have to consider the impact on the baby, too.
Yeah, yeah.
So it's about having those conversations with your doctor, asking questions,
For sure.
making sure you're comfortable with the plan.
Okay, cool. And, kind of on the topic of things that are like a little controversial, the chapter also talks about the rising rate of C-sections.
Yeah,
It seems like they're becoming more and more common.
they are. And there's a lot of reasons for that.
Like what?
Well, for one, more women are having babies later in life these days,
Mhm.
and that comes with more risks. We're also seeing more women with conditions like obesity and gestational diabetes, which can complicate things.
So those are like legitimate medical reasons
Right.
for having a C-section?
Exactly. And then there's the rise in multiple births, thanks to things like IVF.
Makes sense. But what about those like societal factors you were talking about?
Oh, yeah. So there's definitely this perception out there that C-sections are more convenient,
Right, right.
maybe less painful.
Or even like they can plan it out, like,
Exactly. It feels more predictable.
yeah, yeah, controllable.
And I think, honestly, for some women, the thought of labor is just, like, terrifying.
Oh, yeah, I can imagine.
So a scheduled C-section can feel more manageable.
Yeah, for sure. And you also mentioned something about legal considerations.
Yeah, unfortunately, doctors are sometimes worried about getting sued if something goes wrong during a vaginal delivery.
Yeah.
So in some cases, they might recommend a C-section to, minimize their own risk, even if it's not strictly medically necessary.
It's kind of a messed up situation.
It is. It highlights how important it is to have open and honest conversations with your doctor, understand the risks and benefits of both vaginal and cesarean deliveries, and make the choice that feels right for you.
Yeah, it all comes back to that shared decision-making, doesn't it?
It really does.
Talking about all these complications and procedures can make childbirth seem kind of scary.
Yeah, it can.
But it's important to remember it's also an incredibly personal and emotional experience.
Oh, absolutely.
It's not just a medical event. It's like a life-changing event.
It's transformative, and the way it's handled can have a lasting impact on women and
Yeah.
her relationship with her body.
It really makes you realize how important postpartum care is,
Huge EE.
not just for physical recovery, but for the emotional side of things too.
Exactly. It's about processing that whole birth experience,
Yeah.
whether it was straightforward or complicated,
Right. Right.
and having support for any trauma or complications that might have come up.
So it's like the aftercare is just as important as the birth itself.
Oh, I'd argue it's even more important.
Wow. Okay. Tell me more.
Well, think about it. You've just gone through this incredibly intense physical and emotional experience. Your hormones are all over the place. You're sleep deprived. You're trying to figure out this whole new human being.
And you might be dealing with pain or discomfort from the birth?
Exactly. So whether it's physical therapy, counseling, or just having a strong support network, all of those things are so crucial for helping women thrive in that postpartum period.
It sounds like we need to be talking a lot more about postpartum care and support, not just focusing on the pregnancy and birth.
100%. It's about that whole journey into parenthood, not just getting the baby out.
Yeah, it's a holistic approach.
Exactly.
We've talked a lot about the challenges, but what about the positive stuff? Like, what advancements are giving us hope for the future? What's getting you excited?
Oh, there's a lot. Researchers are doing amazing work in predicting and preventing preterm labor, which we know is a huge source of complications.
Yeah.
They're finding biomarkers that can tell us who's at risk and even working on progesterone treatments that can help prevent it in some women.
Wow, so it's like we're finally starting to crack the code on this.
We're getting there. And what about pain management? We talked earlier about some of the downsides of medications.
Mhm.
Well, there's this growing interest in non-pharmacological options like water births, acupuncture, massage, even hypnosis.
Oh, cool. So it's about giving women more choices.
Exactly. And recognizing that each woman's experience is unique.
Yeah, yeah, that makes sense. What other innovations are you excited about?
Well, one area that's really interesting is telemedicine.
Oh, yeah, telehealth. I've been hearing about that, but I can't quite picture having a baby through a Zoom call.
Huh, no, not quite. But imagine women in rural areas who have trouble accessing health care,
Right.
being able to have virtual checkups.
Oh, that would be amazing.
Or high-risk pregnancies being monitored remotely, using wearable technology.
Wow, that's incredible. It could really break down barriers.
It could, and it's starting to happen already.
Really?
Yeah, it's not meant to replace in-person care, but it can be a really valuable tool.
So it sounds like the future of maternal care is moving towards something more personalized, holistic, and high-tech.
I think so. It's definitely an exciting time to be in this field.
It is, but I'm curious about the potential downsides of all this new technology.
Hmm.
Earlier, we talked about concerns with off-label drug use.
Yeah.
Could something similar happen with technology? Like, could there be a rush to adopt new stuff before we fully understand the risks?
That's a really good point. And it's something we have to be careful about. We need to do the research, make sure things are safe and effective,
Right.
not just get swept up in the excitement of new gadgets.
It's about being thoughtful and deliberate.
Exactly.
Technology is a powerful tool, but it's not a cure-all.
Well said.
Okay, so the future of maternal care sounds like it'll require like a delicate balance
Mm-hmm.
between embracing innovation and being cautious.
I think so. And it needs to be a conversation,
Mm.
between researchers, doctors, patients, policymakers.
Yeah.
We all have to work together to use technology responsibly.
For sure. Speaking of things that require collaboration,
Mhm.
one thing that's become clear in recent years is that there's this huge disparity in maternal health outcomes,
Oh, yeah, it's a crisis.
especially for women of color.
Absolutely.
It's heartbreaking.
It is. The fact that Black women are so much more likely to experience complications and even die during pregnancy and childbirth, it's just
That
unacceptable.
really is.
Mhm.
So what can we actually do about this? Like, what needs to change?
It's a big question with a lot of answers. First of all, we need more research to really understand what's driving these disparities. We
Okay.
can't solve a problem we don't fully understand.
Right.
We also need to improve access to quality prenatal care for all women,
Hmm.
no matter their race, ethnicity, or income level. Healthcare is a right, not a privilege.
Absolutely. And what about the biases that exist, like within the healthcare system itself? How do we address those?
That's so important. We need to acknowledge that implicit bias exists, even among well-intentioned healthcare providers,
Right.
and actively work to dismantle those biases. That means training, promoting diversity in the workforce, creating a culture of respect and empathy.
So it's about recognizing those systemic issues
Mm-hmm.
and working to dismantle them.
Exactly. It's a long road, but it's worth it.
It is. It's about creating a system that's truly equitable and just for all women.
That's the goal.
This whole deep dive has really opened my eyes to the complexities of this topic.
Yeah, me too.
It's not just about the medical stuff. It's about, like, the human experience, the societal context, the fight for equity.
It all ties together.
It really does. And I think it's a reminder that we all have a role to play
We do.
in making things better for moms and babies.
Absolutely. Whether you're a parent, a healthcare provider, a policymaker, or just someone who cares,
Mm-hmm.
there's something you can do.
So to our listener, keep learning about this, ask questions, and be an advocate.
Yes. Advocate for yourself and for other women.
And as you do that, we'll leave you with this final thought.
Okay, hit me.
What would it take to create a world where every woman has the care and support she needs
Mm-hmm.
to have a safe, healthy, and empowering birth experience?
That's a great question. A really important question.
It is, and it's one we all need to be thinking about.
Absolutely.
All right, well, this has been an amazing conversation. Thank you so much for joining us.
Thank you. This was fun.
And to our listener, we'll be back soon with another deep dive. Until then, happy listening. Wow, it's kind of wild how we started with a chapter on, the nuts and bolts of labor complications. And we ended up talking about, systemic racism and the need for, a better social safety net.
Yeah, it really shows you how it's all connected, right?
It does. It's not just about what happens in that delivery room.
Right.
It's about a woman's whole life, leading up to that point.
Exactly. Her health before pregnancy, access to education, good jobs, safe housing, all of that plays a role.
It's like we're finally realizing that healthcare isn't just about, hospitals or doctors.
Right.
It's about creating a society that actually supports families.
100%. It's about investing in those things that help families thrive,
Yeah.
early childhood education, affordable housing,
Mm.
job training, all of that, and recognizing that women of color face extra challenges.
Yeah, absolutely.
So we need targeted support to address those inequities.
Something that keeps coming back to me throughout this whole deep dive is how important it is to just, listen to women when it
Yes,
comes to their own care.
absolutely. For too long, women's voices have been dismissed or minimized. It's
Yeah.
time to actually center women in these conversations.
Yeah, for sure. So what are you hearing from women? What are their biggest fears and concerns when it comes to labor and birth?
Honestly, I think a big one is just fear of the unknown.
Yeah, I can imagine.
Childbirth is a huge life event.
Right.
And for a lot of women, it's just this big mystery. They've heard stories, seen movies.
Right. Or maybe even witnessed a difficult birth themselves.
Exactly. So it's natural to feel anxious about something so intense.
Yeah, totally. So
Yeah.
it's not just about providing medical care, it's about addressing that fear.
It is. Education is key.
Mhm.
When women understand what's happening, what the options are, they feel more empowered.
It's about replacing that fear with knowledge.
Exactly. And creating a space where they feel comfortable asking questions.
Yeah, where they don't feel judged.
Exactly. That's how you build trust between women and their healthcare providers.
Absolutely. But as we talk about listening to women, we have to acknowledge that they don't always agree, right?
That's true.
There are different philosophies about childbirth.
Oh, yeah.
Sometimes they even clash.
Yeah, you have some women who are all about natural birth, no interventions,
Right?
and others who are more comfortable with medical technology.
Right.
Both perspectives are valid.
Yeah, for sure.
It's about respecting those differences, but also making sure everyone has accurate information.
Right, so they can make informed choices.
Exactly. At the end of the day, we all want the same thing, right? Healthy moms and healthy babies.
Well said. This has been such an eye-opening conversation.
Yeah, it has.
It's a reminder that we all have a role to play in making things better for moms and babies.
Absolutely. No matter who you are, there's something you can do.
So to our listener, we encourage you to keep learning, keep asking questions.
And be an advocate for yourself and for other women.
Yes. And as you do that, we'll leave you with this final thought to ponder. What would it take to create a world where every woman has the care and support she needs to have a safe, healthy, and empowering birth experience?
That's a great question to think about.
It is. And until next time, happy listening.